Your blood tests, endoscopy, scans are all normal, but you feel bloated every single day. Is it stress? Is it acidity? Is it IBS? Or is it something that we can actually measure and detect? In this video today, I will explain the hydrogen breath test for SIBO, small intestinal bacterial overgrowth, a scientifically validated non-invasive test that is increasingly changing how we manage people with chronic bloating, gas, and IBS. You will see in this video what the test involves in real life scenario. SIBO stands for small intestinal bacterial overgrowth. Under normal circumstances, our small intestine has relatively less amount of bacteria. So when we talk about bacteria, it's all in the colon, large intestine that has got trillions of bacteria. There is a natural separation that is maintained by the movement of the gut, by the stomach acid, and also this ileocecal valve, which is a valve that is regulating the liquid waste coming out of the small intestine so that there is no backflow into the small intestine from the colon. In SIBO, what happens is there is excess of bacteria that starts to colonize in the small intestine. Because there is more bacteria in the wrong place, the food what we eat, the carbohydrates, these are fermented prematurely. So this fermentation starts to produce more gas like hydrogen, methane. More gas means more distension of the abdomen. So it can affect the movement of the intestine. Thereby you start to get a lot of symptoms, predominantly excessive bloating repeatedly, feeling very tight in the abdomen, excess of gas, so you keep farting repeatedly. Sometimes it can be offensive smell. There can be change in the bowel habit in the form of diarrhea. Some people also have constipation. You can start getting very fatigued, very tired. Despite having a good night's sleep, you don't feel your energy levels are good. Despite correcting your vitamin D, vitamin B12, iron levels, you still are running low on energy. You're not able to think straight. So there is this brain fog, nutritional deficiencies. In India, we are seeing increasingly high number of people with SIBO because of several risk factors. One, frequent antibiotic use for simple issues, common cough, cold, sore throats, they're taking antibiotics. Secondly, diet is high in carbohydrates and also refined sugar. Thirdly, chronic stress can also affect our gut microbiome. You can get this post-infection kind of IBS, irritable bowel, from repeated food poisoning, infections that can affect the gut. People with diabetes, if it is not well controlled, even in people with underactive thyroid, those with kind of sedentary lifestyle, especially people who are doing sitting kind of jobs without much movement, long-term acid medication use. So variety of reasons. SIBO often gets missed because people are labeled as IBS. They have been given antacids by their general practitioners, their doctors repeatedly. They've been told there is nothing wrong with them. It's just stress. It's in your brain. So SIBO is often missed because of these issues. Hydrogen breath test. What is it? It is a non-invasive test. There is no pain whatsoever. It is simply blowing into a small device. There is no endoscopy, no injections, so you don't need to take any medicines for the test. Just simple breathing into this machine multiple times. So it measures the gas released from the small intestine that gets absorbed into the bloodstream and then exhaled through the breath. Hydrogen and methane, these gases are produced when bacteria starts to ferment the carbohydrates. So if these gases start to rise early and on, that means there is a small intestinal bacterial overgrowth. So who should do this test? You should consider having hydrogen breath test for SIBO if you are repeatedly getting bloated, if you're taking medicines and that is not responding, if you've been suffering with IBS symptoms for a long time, if you start to experience gas and that kind of fullness immediately after eating, if you're feeling heavy, tight in the abdomen all the time, if you have persistent gut issues, if you have diabetes and having gut symptoms, if you got underactive thyroid despite taking thyroxine, you're still having problems with constipation and other gut issues. If you're using long-term antacid medicines, or if you're getting repeated B12 deficiency and you don't quite know what's the reason despite eating non-vegetarian food, if you're frequently getting loose motions and you've been told all your tests are normal, you have gluten allergy, celiac disease. So despite sticking to the gluten-free diet, your condition is not improving. All these conditions, this test becomes highly relevant, especially when you had endoscopies, colonoscopies, scans, blood tests, all are normal, but your symptoms persist. So this is where the hydrogen breath test comes in. Common myths our country people have is everybody has gas issues, don't worry about it, it's a very normal thing. Secondly, saying this is all stress related, you have IBS, there is no test for it, you have to live with it. And only procedures like colonoscopy, endoscopies can diagnose the gut problems. So these are all myths. Blood test normal, scan normal, so there is nothing wrong with you. People start to blame the gut symptoms on liver. Liver is the last organ in the body to actually give you symptoms. So hydrogen breath test helps detect what these routine tests, these full body blood test checkups, what they will miss. In this video, now I will explain the procedure step by step, and we will take assistance of our sister Prashikala, who will also explain this in a bit more detail.
Good morning, I am Prashikala, endoscopy technician. Today I am going to show hydrogen breath test, where we will check the small intestinal bacterial overgrowth. This is the hydrogen breath test machine, where we will test the patient breath for hydrogen for small intestinal bacterial overgrowth. This is hydrogen breath test machine, sir. We are checking your small intestinal bacterial overgrowth through the breath. Okay. So first you are in empty stomach now. So with the empty stomach, we will be taking the basal readings. In the sense, when you are empty stomach, we will take few readings, 1 to 3 readings. So what you have to do, you have to inhale. When the 5 seconds are left in the machine, you have to take a deep breath through the nose. Then you have to hold this mouthpiece in your mouth and blow the breath. Okay, whatever the breath you inhale, that breath you have to blow in this. Okay, shall we start, sir?
Yes.
Yes, sir. Now we have taken your basal reading. Okay, then next we will be giving you to drink a Glucon-D water, that is 75 gram Glucon-D with 200 ml of water. Then you have to drink that water, then wait for 15 minutes. So every 15 minutes we will be checking your breath. Okay, that is every 15 minutes 6 readings, in the sense 90 minutes. Okay, so you may need to stay in the hospital over 1.5 hours to 2 hours.
There is some preparation involved prior to this hydrogen breath test. So let's say you're having the test tomorrow. So today you should stick to a low fiber diet, not eating foods that give you strong smells like too much of onion, garlic, lot of lentil legumes. Try and avoid eating anything that is greasy, oily, fried items, too much of spices, masala rich foods. You'll be allowed to take simple lunch the day before, more of a rice-based diet for the dinner. There is an overnight fasting that is required, ideally up to 12 hours. So the next day morning, without any breakfast and not drinking large amounts of water, you'll be asked to come first thing in the morning. Here at Bangalore Gastro Center Hospitals, we start our patients as early as 7 a.m. So there is a baseline breath sample that is analyzed. You'll be asked to blow into this device where we measure the baseline hydrogen value. Normal hydrogen values in a person who has a healthy digestive system, we expect it to be well below 10, definitely below 16, which is ppm we measure called parts per million. So if your baseline level itself is very high, then you'll be asked to go back on a special diet, come back the next day. If your baseline value is fine, we will proceed with the test. And you'll be given small quantities of this glucose water to drink, and the breath analysis is done every 15-20 minutes. So if there is excess of bacteria in the small intestine, they start to ferment this early. So there is a high amount of hydrogen gas that gets released. So when hydrogen breath test is given to test for SIBO, that rise in hydrogen by 20 ppm, what we measure the parts per million above the baseline value, that must occur within that 1.5 hour, 90 minutes, as the hydrogen is being fermented in your small intestine. Normally it gets fermented in the colon. So once you get the report, you will be consulting a gastroenterologist. And importantly, what's next? What does this report mean to me as a patient? Can something be altered in my diet? Is there something I need to change in my lifestyle? This is where the specialist input, treatment, and comes in. Firstly, there could be dietary modifications. You might need to go on what we call as a low FODMAP diet. Our gastroenterology dietitian will go through your diet in more detail to see whether there are certain foods that you need to actually cut out. Secondly, there might be medicines that might be needed to improve the movement of the food and liquid through your stomach, what we call as the motility medicines. There might be certain antibiotics that we need to specifically use for this, not just some random antibiotics that you use for all kinds of infections. We also need to look at, is there an underlying cause? Is your diabetes not well controlled? Have you got an underactive thyroid that is not well controlled? Have you got any other metabolic issues that might be contributing? Many people think having SIBO means just taking probiotics. It's not about just taking probiotics. It requires a structured specialist gastroenterologist approach where probiotics, antibiotics, along with diet and lifestyle changes. Not every bloated person has got SIBO, and positive SIBO test doesn't mean that you have some serious gut disease. But in the right patient, interpreted by the right specialist, hydrogen breath test can actually change the course of your symptoms. If your symptoms are repetitive, persistent, do not just normalize suffering thinking that bloating and gas is normal for everyone. Modern gastroenterology is about precision, giving the right advice, getting the right diagnosis, not guesswork. Please share this video for those who might be suffering from repeated gut issues, and if they want to know more about this simple hydrogen breath test for SIBO. Thank you.